And then you see here, so we're going to talk for just a couple of minutes about the trial here. And I'm really honored to have done this with Dr. Ann Hathaway, Dr. Kat Toops, and Dr. Deborah Gordon. It's the first trial. Instead of predetermining a treatment, which if you think about it really makes no sense, we're actually looking at what's causing the problem and then addressing that. And then you go to the next one here. So we were denied 2011 and 2018 again. So we did a lot of actually background work. And finally, in 2019, it was approved. It's a small proof of concept trial. You can read about it now. It's in the Journal of Alzheimer's Disease. It's been published. And also there's some press releases around it in various newspapers, et cetera. So 25 patients. Now, these patients were in that third and fourth stage. Of course, it would be even easier if they were in the first two stages, but we purposefully took them in the MCI or early dementia stage. And why did we do that? Because that's the same stage that Aducanumab took their patients. So we wanted to show, whereas that didn't help, we wanted to show that, in fact, we can help a lot. And so we compared the personalized precision medicine protocol to just historical outcomes. We know what happens to these patients. There's a tremendous amount written about them. They go downhill, as we know. So we looked at all the different root causes, and then we addressed those specific causes. Let's talk about how we evaluated them and what the outcomes was. So we used the Montreal Cognitive Assessment, 0, 3, 6, and 9 months. If you go to the next one here, we also used a more sensitive online test, CNS vital signs, which is great because it then gives us a larger dynamic range. We can look at people who are less impaired and more impaired. Then we use the AQ21, which is where their partners will say, hey, they've had this problem or they've had that problem. And then you go to the next one, we use something called the AQ20, which is a change scale, which was actually created by QuestGen. It's just an estimate of, did these people get better or worse? Then we looked at MRIs at the beginning and end. Did their MRIs get worse? People with MCI or Alzheimer's have MRIs that we know how quickly they get worse, and they virtually always get worse. And if you go to the next one, and first thing was we looked at their metabolic changes. As you can see here, everything improved. And everything was statistically significant in its improvement, except the trend we saw in HOMA-IR. We simply didn't have enough HOMA-IRs at the end stage on several of the patients. But there, even with what we had, there was a trend. So everything improved metabolically. And then if you go to the next one, did that associate with cognitive testing? And the answer was yes, it did. And if you go through here, so this just shows that as they went along, they improved at 3 months, more improvement at 6 months, and still more improvement at 9 months. We had a few drop off at 9 months because the pandemic hit right there between the 6 and the 9 months. So no surprise, a few people stopped doing the right thing and actually fell off a bit. But overall, as a group, they still did better than the 6 months. So they continued to improve, which is, again, unheard of in Alzheimer's trials. And then you can see here, 84% of these people improved, 4% of them were stable, 12% declined. And the few that declined, in fact, typically you could see why. One person had a lot of mycotoxins in her home and said, I'm not leaving, I'm not remediating my home, I'm just going to stay here. No surprise, she continued to decline. And if you go to the next one, so it is important to address the things that are causing this. If you look at their gray matter volume, here, the former versus the new, they actually improved. This is from one specific patient who actually was not in this trial. But if you look at the gray matter, you can see the gray matter here is largely in this cortical ribbon that's being traced around here. And the computer will actually go through here painstakingly and figure out. So the gray matter improved in these people. And the hippocampal volume, which you can see here, there's the hippocampal volume there, in these patients in the trial, had a minimal change. It actually was slightly smaller in the trial, but less so than normal aging and much less so than other people who had MCI or Alzheimer's. So by all of these criteria, these people did very, very well. And if you go to the next one, so so if you just go through MoCA test, neurocognitive index, cognitive subtests, AQ20 change scale, brain HQ, MRI, hippocampal volume, everything in here was better. If you go to the next one, there we go. So we published a number of papers, and if you look at this third one here, this is the one, that one there, yeah. So this one just came out in Journal of Alzheimer's Disease. a peer-reviewed journal, a very good journal for studies of Alzheimer's disease. And now we're on to a larger randomized controlled trial, which is just starting in the next couple of months. And as I mentioned earlier, we'll be able to use things like epigenetics and phospho-tau and things that weren't available even a couple of years ago. And if you go to the next one, and this, of course, you'll see about this in the books. And this one here in the middle, Julie wrote extensively about the approach, all the things that you actually need to do to make this work as someone who's done exceedingly well herself. And if you go to the next one here, and you hit there we go. So the bottom line is we are exiting the era in which Alzheimer's disease is an inevitability for so many people. It's going to become a former scourge.